So one of the most heartbreaking things I hear from women is this. I had surgery to open my tubes and then they blocked again. And when that happens, women feel devastated, like their body failed them a second time. But I need you to understand something very important. The surgery was not necessarily the problem. The problem is that surgery often changes the structure without changing the environment that caused the blockage in the first place. And if the inflammatory environment stays the same, the body will usually continue doing what it was doing before. Now let's talk about why this happens. When the body experiences inflammation for a long time, whether from endometriosis, estrogen dominance, chronic pelvic congestion, infection, immune activation, or irritation, the tissue becomes reactive, and the body starts trying to protect itself. And one of the ways it protects itself is through scar tissue formation. Scar tissue is not the body attacking you. It's the body trying to stabilize an area that feels inflamed or injured. Now here's where it gets a little complicated. Surgery itself creates trauma to tissue. Even when surgery is done beautifully, even when the surgeon is skilled, the body still has to heal afterward. And healing after surgery always involves inflammation. That's normal. The problem is when the body is already living in a highly inflammatory environment before surgery even happens. Because then the body may overproduce fibrin during healing and new adhesions can begin forming again. And this is why some women experience re-blockage. Not because their body is hopeless and not because surgery never works, but because structure was addressed while terrain was left unchanged. And terrain matters. Inflammation matters, hormonal balance matters, circulation matters, lymphatic drainage matters, immune signaling matters. Fallopian tubes are living tissue. If the environment stays congested, inflamed, irritated, tissue often responds by tightening, swelling, sticking, or reforming adhesions. That's why when I work with women, my focus is not just on opening the tubes. It's on changing the environment that caused the blockage to happen in the first place. Because once the terrain shifts, the body often stops reinforcing the problem. And this is also why many women use the FTF system after tubal surgery or tubal reversal to support circulation, reduce inflammation, and help support the healing environment while the tissue is recovering. Healing is not just about removing blockage. It's about changing the conditions that created it. Do you know someone who wants to have a baby but is having a hard time getting pregnant? Maybe I can help. Go to ftfsystem.com and start with the FTF 3-pack. I've helped hundreds of women. Maybe I can help you too.